Good morning if you're in Hawaii or Guam, and good afternoon if you are in Alaska, Montana, or Wyoming. I'm Jill Holt, and I work on the nursing home team with Mountain Pacific. And I just want to take a minute and welcome you to our presentation today. Our presentation will be a 13-week series every Wednesday at 2:30 for about a half an hour, give or take. We certainly have the capacity to go a little bit over if there's engagement and questions. And so I want to just give a few little housekeeping comments. First of all, if you would, in the chat box, if you think of presentations or webinars or future needs that you might have for future presentations, just put that in the chat box and we'll be sure to address that when we build these weekly sessions. And then this series is a 13-week series. As I mentioned, it'll be on Wednesdays at 2:30. We're going to start our presentation with the clinical office hours, and presenting during the clinical office hours will be my colleague, Kyla Newland. She's a pharmacist. She lives in Alaska. And we thought that it might, and we're going to kind of be flexible with this series. It's interactive. It's really about what your needs are, and you know, just trying to help get as much information to you as we can to make your jobs and lives easier. So if you have questions, you can put them in the chat box. You can ask them certainly throughout the presentation. Again, it's interactive. And then if at the very end we run a little tight on time, all of these PowerPoint slides are available and will be sent to everybody. So if we run out of any time at the end, we'll be able to share the information that way as well. So Kyla, the floor is yours.
Thank you, Jill. So as Jill mentioned, I'm Kyla Newland, and I am a pharmacist at Mountain Pacific. And so the portion that I'm going to kind of be in charge of today is just giving you guys some updates about the booster recommendations and updates and any changes in the clinical considerations that the CDC has put out. Here, things are changing, you know, daily, we know, with COVID. So just making sure that you guys have the most up-to-date information and resources so that you know what's going on. So these were the changes to the clinical considerations that were made just on January 6th. And this basically expanded the booster recommendations to go down to age 12. And then they also changed the time frame for that booster dose from 6 months to 5 months, and added the additional dose for the immunocompromised in the age group of 5 to 11, which was previously a recommendation for the older group, but has now been lowered to that 5 years and older age range. And then they also did some updates about folks that had received vaccines outside of the United States and kind of what they need to do to either complete or boost their series here in the United States. And that link there, and all these links are also going to be at the end in our resources section. And then I'm going to have some links in the chat too as we move through. Next slide, please. So this is something that the CDC also put out. This basically was just kind of like a nice overview of key points of where we're at with vaccination and with the pandemic at this point. High points, obviously, we know that these vaccines are reducing severe disease, hospitalization, and death, which is really our main goal of vaccinating folks at this time. We know we're seeing a lot of breakthrough, but the most important thing is that these people aren't getting as sick as the folks that do not have a vaccine. They did do also, they said that the mRNA vaccines are preferred over the J&J, mostly based on some safety concerns with J&J, and then also the efficacy hasn't been shown to be as good for the J&J vaccine, as I'm sure you guys know. There are some exceptions where they say folks can go ahead and get J&J, but it would be if someone had like a severe anaphylactic reaction to one of the mRNA vaccines, or if there's limited access, which I don't think there is in any areas at this time, or if they just prefer to get the J&J for some reason. Let's see. So we know that for the moderately or severely immunocompromised, those folks need to get that third dose to be considered part of their primary series. And then I think this, yeah, that's kind of repetitive. Just the booster dose was actually expanded down to age 12, whereas before it was for the older age group. And just basically reiterating the fact that vaccines are a very strong tool to help us get through this pandemic. Next slide, please. So this is just a chart. This is the up-to-date information on boosters, when to get it, what age group they are they're indicated for. There's additional information too with the link on the bottom where you can kind of get more details. But this is a nice chart that you can reference, and it was updated just in the last week. Next slide, please. So kind of in preparation for our question and answer period, I just grabbed a few of the common questions that I think people are asking, but feel free to put additional questions or ask additional questions. I can go through these, or if anybody has any questions at this time, just starting out, we can see if anybody wants to speak up, or I can just go through the questions as well. Okay, back. Okay, so I'll just answer these, and maybe as we find the answers, maybe we'll have additional questions. So how long after actually contracting the disease do you have to wait to get a booster dose? And the answer is the same for a booster dose or for any primary vaccination as well. And that is until your acute illness has resolved and you have met your any kind of quarantine or isolation requirements that are advised by the CDC. Okay, I see a question in chat. I haven't seen any guidance. The question is there any guidance to a second booster shot yet? And I don't think there's anything out there solid yet for that. I will say that there is a population of patients that are recommended to get 4 doses at this time. And that would be those immunocompromised, because they get the 2 doses to begin with, then they get the 3rd dose 28 days later. And they would also be recommended to get that booster dose 5 months after that 3rd dose. So they would actually be getting 4 doses. So the 90-day wait period, when COVID first started, it was never an official, like you have to wait 90 days to get your vaccine, but the theory was you should have pretty good immunity for that 90 days following, so you might want to wait. And that was related more to like supply chain issues, I think, too, because we wanted to make sure, you know, if you were protected, you could let someone else get their vaccine and wait that 90 days. But that is no longer a recommendation. The only recommendation for the 90-day wait period is if you've actually received the monoclonal antibody treatment for COVID, then you should wait 90 days to get any kind of vaccine for COVID-19. Okay, another question. Any good, bad, or indifferent on residual of mixing brands types of the vaccine? 2 doses Mrna and booster Visor. So in general, Mrna is showing the best, the longest lasting and the best efficacy as far as antibody titer levels. So I do know that some folks have chosen, if they got Visor for their initial vaccine series, to get Mrna for the booster. The recommendations are that you can get either one. And even if you got J&J, you can get Mrna or Visor additionally for your booster. So there's kind of some terminology stuff that I wanted to go through that can be confusing. These terms, fully vaccinated versus up to date. there is official kind of definitions that the CDC has. So up to date means you've received all recommended COVID-19 vaccines, including any booster dose when eligible. And fully vaccinated means that you have received the primary series. So the primary series would be the 2 doses for the mRNA vaccines, the 1 dose of J&J, or if you're an immunocompromised person, it would be the 3 doses for primary vaccination. And then the difference between, and I've kind of already talked about this, but the extra primary dose and a booster vaccine. So that extra primary dose is recommended, and that's for the immunocompromised. That would be 28 days after your initial 2-dose series, or 1 dose for J&J. Okay, another question. We have people asking about different conditions and whether they're immunocompromised. Okay, so that is actually one of the links. Mrna, did I include that? I think I included that in a list that we can put in chat, but it's also on the last slide. So there's kind of an extensive list there. And the other thing with that is, if a patient thinks they're immunocompromised and they would like to get that dose, they just self-identify at most. I don't know if this is true at all organizations, but I know at the pharmacy, if they identify as an immunocompromised person, then we're going to go ahead and give them their dose that they want to get. Thank you, Miranda, for putting that in there. Yeah, so I don't think in general all long-term care residents with underlying health conditions, you'd have to look at that list and see, but you know, if you think someone is immunocompromised and they really want to get another dose, you know, I think that's probably fine. So side effects with the booster vaccine, similar to what we see with our primary series. With the Mrna vaccine, you do get half the dosage on your booster. So, you know, potentially maybe less side effects, but those side effects: headache, chills, fever, muscle aches, soreness, redness at the injection site, and fatigue. We know that there's those rare side effects too. The myocarditis, pericarditis, that's been shown to be most commonly after the 2nd dose of an mRNA vaccine. They are seeing a little bit higher rate with Mrna versus Visor. And that usually will happen about a week after vaccination. And they are seeing a little bit of data that they're seeing this happen with booster doses as well. But it's usually in young adults and more prone in the male population. And then with J&J, the occurrence of blood clots in women 30 to 49 is about 1 case in every 100,000 doses. So that's one of the reasons that they primarily decided to recommend the mRNA vaccines over the J&J vaccine. And then booster doses and Omicron. And really just vaccination in general, but we do see a pretty big waning after 2 doses and a kind of a resurgent for Omicron with that booster dose. I actually, if I could share my screen, Mary, I've got a chart that you guys can look at. Get it up here. I guess it's a graph. Okay, are you guys seeing this Visor mRNA vaccine effectiveness graph?
Yes, we're seeing it, Kyla.
Okay, so this shows, and this was done in the UK, but it shows the Pfizer vaccine, the Mrna vaccine, and those right 2 columns are with the booster dose and what the effectiveness is against Omicron. So it's definitely higher with the Mrna, which is the one on the far right, than it is with the Pfizer, but we're still seeing pretty good coverage, but it's not as good as it was with Delta. As you can see, the Delta is the black and the Omicron is the gray. Okay, so thank you, Miranda. There's a new link in the chat for the vaccine stay up to date. And up to date is, I guess, supposed to be the new kind of terminology that folks are going to be trying to use when they're talking about vaccine status. So I think that's kind of all the questions that I had that I had put together that were common. Did we have any other questions in chat that I missed?
I'm not seeing any new questions, Kyla.
Okay. Well, Jill, did you want to go ahead and present the stuff that you had?
Sure, thank you, Kyla. So now we're going to move into and shift gears and move into a little different topic here. And this is regarding the mandates. I know those are on everybody's hearts and minds, and you're trying to figure all this out. And so what I wanted to do was just start with a kind of a depiction here of the timeline. These COVID-19 vaccine mandates were first introduced to us on November 5th by CMS. And the rule was to establish that all employees needed to be vaccinated with COVID-19 vaccines. And then, as you'll recall, on November 5th, then there was a hold or a stay placed on by some of the states, placed on the vaccine mandate. And so everybody kind of pushed ahead and then stepped back on November 30th, waiting to see what would happen next. And then sure enough, on December 15th, the mandate injunction was lifted for Hawaii. And I mentioned Hawaii because they're part of our region. However, some of the original states who were part of the original lawsuit, including Montana, Wyoming, and Alaska, were still pending. So the November 5th timeline then was still a go for those of you living in Hawaii. However, Montana, Wyoming, and Alaska were put on pause. And then pending the Supreme Court, United States Supreme Court, having a chance to evaluate the mandates from the CMS and whether they had the legal authority to issue those mandates. And sure enough, on January 14th, we all were made aware that the United States Supreme Court did lift that injunction for the remaining 25 states. So therefore, all of us are now subject to these mandates for vaccinating staff. Next slide, please. So this slide, and I think it's important to just, let me call out right away that this slide is just relative to our friends in Guam and Hawaii, because the timelines are a little bit different for everybody else. So 30 days from the issuance of the memorandum, on January 27th is the first cutoff for having had 100% of the staff having received at least one dose of COVID-19 vaccine, or have a pending request for an exemption, or have been granted a qualifying exemption. February 28th is the next deadline. By then, that's 60 days from the original issuance of the memorandum. And on February 28th, from Guam and Hawaii, you will want to have 100% of your staff having already received whatever necessary doses remain to complete the vaccine series. So if it is a Johnson & Johnson dose, then you would have already met that criteria, hopefully in the 30-day cutoff. But in any event, everybody having completed the series for February 28th is the new cutoff date for those 60 days, or having already been granted a qualifying exemption, or have any other issue or identified situation that CDC may have put into place between now and February 28th. We just throw that out there because we never say never, right? So the facilities will be considered to be in compliance if those two criteria are met, January 27th and February 28th. There is language in the memo sent out from CMS, and that memo is QSO 2209 and actually 2207 for Hawaii and Guam. But there is language that is in great detail indicating how facilities will be determined to be in compliance. So you're fully compliant with these terms that are on the slide there, the January 27th and February 28th. However, there is language in that memo that says that if less than 100% of staff have received at least one dose of the single dose vaccine or all of the doses, or have not been granted the qualifying exemptions, that you will receive notice of non-compliance. So then if a facility is above 90% of compliance, meaning 90% of the staff, not 100% of the staff, are in compliance, then they will not be subject to additional, and they always use the word additional enforcement action. So I'm going to talk more about that in another slide. So just kind of hold that thought. I don't want to confuse you. So just hold that there. And let's flip to the next slide, Mary, and talk just for a quick minute about the timelines for those of us in Alaska, Montana, and Wyoming. So the same terms apply as they did for Hawaii and Guam. However, the dates are a little bit different, of course, because we didn't get the ruling from the Supreme Court until January 14th. So by February 14th, you will want to have, which is 30 days from the issuance of that memo on January 14th, you're going to want to have your policies and procedures developed and implemented, and you're going to want to have 100% of your staff having received at least one dose of their COVID vaccine, or again, have a pending request or an exemption for such. And then by March 15th, the 60 days past the issuance of the memorandum, again, 100% of the staff have completed their vaccine series. All right, now I want to talk a little bit about that other kind of loose language, if you will, or interpretive language in the guidance. So the guidance will help the surveyors determine the severity of the non-compliance deficiency that they may find when at a facility. So these are the thresholds here. So facilities are less than 100%, but more than 80% of the staff have, 80% or higher, are in vaccine compliance. Then but you have plans to get into 100% compliance within 60 days. You're given an opportunity to return to compliance without additional enforcement action. And that same language applies to that 60-day mark. Greater than 90% of the staff, so that's increased from 80 to 90, but still less than 100% of the staff with a plan to achieve 100% compliance in order to satisfy those terms of the regulation, will also not be subject to additional enforcement actions. So I'm trying to figure out what that all means exactly. It's written such that it's difficult to interpret, but I think that when the surveyors come in, they'll be looking to see exactly where you sit with your compliance rates, and then depending on where you fall into that less than 80%, I'm sorry, greater than 80%, but less than 100, you might have a different scope and severity than you would if you were at maybe at 60% of all of your staff on those first 30 days. So the way that the enforcement actions are very similar. They're not new to nursing homes. They can come in the form of a plan of correction, in a civil money penalty, or perhaps even, I think after CMS has told us that they won't go straight to denial of payment or termination of your contract with the funding sources, but that is meant to be more of a progressive non-compliance measure. So you can expect that surveyors will be looking to see where you sit, and if you haven't met that 100% compliance on 30 days, but you're greater than 80, then the remedies might be somewhat different than if you're outside of those parameters. let's go to the next slide, Mary, please. So CMS has directed the surveyors that after 30 days, so 30 days from January 14th, that they can begin to inquire when they come in, surveyors come into the building for either an initial certification, a recertification survey, a reaccreditation survey, or perhaps a complaint survey. That is the time that surveyors will be looking and asking questions about your vaccination status for your staff. It's my understanding that CMS will not be looking at your data in NHSN and issuing remedies from that source, but rather from on-site survey and time from the health department while they're in a building for those various reasons. Also of notation is that surveyors will not evaluate religious exemptions, nor the rationale for the acceptance or denial of the request. However, you can skip to the next. Oh no, I guess I'm in the same. Sorry, keep it there, Mary. I got ahead of myself. Instead, the surveyors will review whether facilities have an effective process for staff to request those exemptions or a sincerely held religious belief. So again, the surveyors are looking more at process and not, how does somebody go about making that request, not evaluating whether they were appropriate or not. All right, the next page or the next slide now, Mary. Now I'm ready to go to that one. So this is the list of resources that we pulled together for this time with you guys. I think it's important if you go in and look at the QSO 2209 and 2207, at the very end of those memos, there are also some references to attachment A. And I think you'll want to take a look at that attachment A. They vary based on the institution that you work at. So if you work at a long-term care or SNF, attachment A will give you really good guidance on scope and severity, on what the surveyors are going to be looking for, and what some of the detail is for the FTAG 483, which is the tag that you'd be cited for non-compliance with the vaccine. So I think we'll probably have another session maybe in the next couple of weeks where we go over that in more detail, because it's really good information and it kind of gets to the nuts and bolts of what to expect while you're being surveyed. So I guess I would just open up to questions now. Does anybody, I see a question
There's
in there.
a couple questions in chat, Jill.
Yeah.
Yep, I just laid eyes on those. Thanks, Kyla. You're right about the boosters. Boosters are not part of the vaccine mandate right now. Boosters do come into play when you talk about quarantining or exposures, but they are not part of the vaccine mandate formula. So that's a good question.
Jill, there's one above that from Michael about the memo. Can you scroll up? Can you see it?
Do you read the 114 memo pertaining to Wyoming is saying after 60 days, so March 15th, all potential new hires must be fully vaccinated. 1 J&J or 2 Mrna before starting, if not exempt. I do not know that, Michael, without looking into that. So that's a really good question. So if you hire somebody, do they have, I think, well, I'm going to reserve my comments on that, but for my final comment, but my thought is that I believe that was something that was discussed earlier and I need to verify it, but it does seem to me that you can hire somebody with one vaccine. However, you may, and Appendix A talks a lot about this. What do you do with staff that have had only one vaccine or are ineligible for the vaccine, perhaps due to an exemption? How do you test them? What kind of work assignments do they take on? What kind of infection prevention control measures? So I think that question, Michael, might be answered in the Appendix A. I will look there and we can send out in our listservs, we can send out a response to that question. It's a good one, but I think there's some provision and language that allows for that discussion. Or Dana or Marcy, anybody have thoughts about that I'm missing?
Sorry, I'm trying to find my mute. I don't. I've got attachment A pulled up. So if I find it in there, I'll let you know before we close out.
Thank you.
Same here, Jill.
Okay, thanks. Great question. All right, well, we're at the top of our 30 minutes. We appreciate that everybody jumped on today. I hope this was helpful. It's kind of a quickener, if you will, concept. We know you guys are busy. We don't want to take time away from you that's not value added. And so each week we'll have a clinical portion and we'll have a webinar portion where we talk about things that are important and hopefully will help you in your day-to-day work. Again, if you think of anything along the way that you'd like to see presented, we're most happy to accommodate you. We will send the slides out. Yes, good question, Patricia. We will send out the slides based on who's registered. So we'll get those to you in the next day or two or as quick as we can. And then also there is an evaluation link in the chat box. And so it's great for us to have feedback on how we could improve upon these quickeners, if you will, and make this time with you as valuable as possible. So unless there's a question or any other comments, we'll adjourn and see you next Wednesday.
Jill, this is Dana.
Yeah.
We'll still get back to you with a final, and sorry for my printer going there in the back, but I believe, oh gosh, I just lost it. That as long as you have a plan, where did I just find it? Requiring staff who have not completed their primary vaccination series to follow additional precautions, such as adhering to universal source control and physical distancing. So I think if you've got someone who's say partially vaccinated or comes in as partially vaccinated, and you're making sure they're following the CDC infection prevention and control guidance, that would cover you. But again, we'll go through it with a finer tooth comb and let you know if that's different.
Okay, so I think it is in that Appendix A or Attachment A. So thank you, Dana. That was very helpful. And Michael, we appreciate your great questions. Keep us on our toes. That's good for us too. So we'll find out and get that out to everybody. But it sounds like that is a reasonable consideration and process to follow. Thanks, everyone. Take care and be safe.